The morning shift at the nursing skills lab had just begun. Sarah, a nursing student, was preparing for her practical session on intramuscular (IM) injections. Her instructor, Nurse Aisha, reminded the students that giving an IM injection was not simply about inserting a needle, it required correct site selection, patient assessment, infection control, and careful technique. Today's lesson focused on two commonly discussed areas, the ventrogluteal site and the gluteal region. Sarah first reviewed the medication order and confirmed the patient's identity using the required identifiers. She checked the medication name, dose, route, allergies, expiration date, and other medication safety requirements. She explained the procedure to the patient and answered questions before beginning. Patient comfort and safety come first, Nurse Aisha said. Never rush an injection. Sarah performed hand hygiene and prepared the necessary equipment. She positioned the patient comfortably while maintaining privacy and exposing only the area needed for the procedure. Nurse Aisha then explained the ventrogluteal site. The ventrogluteal area is located on the side of the hip, she explained. When this site is selected, the appropriate anatomical landmarks must be identified carefully. It is generally considered a useful IM site because it is away from many major nerves and blood vessels. Sarah carefully identified the landmarks according to her nursing school protocol. She understood that accurate anatomical identification was more important than simply estimating a location. After selecting the site, Sarah cleaned the skin with an appropriate antiseptic according to facility policy and allowed it to dry. She prepared the injection using a septic technique and maintained control of the equipment throughout the procedure. She then administered the medication using the recommended technique taught by her instructor. Her movements were controlled and confident rather than hurried. The patient felt a brief pinch but remained comfortable. Good communication makes a big difference, Nurse Aisha said. Tell the patient what to expect, observe their response, and stop if there is a concerning reaction. After completing the injection, Sarah safely disposed of the needle immediately in an approved sharps container. She never attempted to recap the needle. The lesson then moved to the traditional gluteal region. Nurse Aisha explained that the dorsogluteal site has historically been used for IM injections, but many clinical guidelines favor other sites when appropriate because of the potential risk of injury to the sciatic nerve and other structures. Therefore, healthcare professionals should follow current institutional policies and evidence-based guidance rather than automatically choosing the buttock. Sarah realized that selecting an injection site was a clinical decision, not SI.